management of sarcoidosis patient. So the patients with only bilateral hilar lymphadenopathy, they do not need treatment, as most of them recover spontaneously. But the patient having acute sarcoidosis, steroid is needed. For example, if the patient is having respiratory symptoms, as our patient was having respiratory symptoms, okay, or the patient is having any end organ damage, so we will give the steroid. Okay, NSAIDs are given for joint pains and for Lofgren syndrome and for erythema nodosum. Let me finish the management for erythema nodosum, how to treat. So generally, it needs a symptomatic treatment in the form of NSAIDs. We can give a steroid if it is severe pain and severe involvement is there. Then we can give a steroid if the severe erythema nodosum is there. And generally, the management of erythema nodosum is depending on the cause. We have to treat the underlying cause. If it is because of sarcoidosis, we are going to discuss now the treatment of sarcoidosis. Otherwise, sometimes we may use colchicine if the symptoms are not decreasing with above treatment. Then finally, we can give some immunosuppressive agents if it is not responding to steroid, or steroid is given for long period of time, then we have to go for steroid sparing agents. So this is the general management for erythema nodosum. Now I'm going to management of sarcoidosis again, and here I'm going to highlight when to give steroid. So if the patient is having lung disease especially symptomatic, like the patient is having difficulty in breathing or progressively increasing dyspnea, so we should give steroid. We should start with steroid. Uveitis, if the patient is having uveitis, then there is indication for steroid. And if the patient is having hypercalcemia, then again this is indication for steroid. And if there is neurological or cardiac involvement is there, we have to give the steroid. The dose of steroid should be prednisolone 40 milligram per 24 hours for 4 to 6 weeks. This is the starting dose. Then we have to decrease the dose gradually over the period of 1 year according to the clinical response of the patient. Okay. Mainly significant number of patients will respond to the treatment. Few patients, so they will respond and they will have the remission of the disease. But few patients may have relapses and may need further course or long-term therapy. Other treatment options, in severe case of sarcoidosis, we have to give IV methylprednisolone, or we have to give the other immunosuppressive agent like methotrexate, azathioprine, leflunomide, or mycophenolate mofetil. Now, anti-tumor necrotic factor alpha therapy also included in the management. That includes the infliximab or adalimumab. It is given in refractory cases not responding to other medications. And finally, if the patient is having advanced stage of lung fibrosis and not responding to the treatment, then the lung transplantation would be another option. Can you mute, doctor? Can you mute yourself, please? Okay. So this is all about the management of sarcoidosis.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.